Morning, everybody. I would like to call to order our Public Health Committee special meeting this morning. The date is Tuesday, September 24th, and the time is 10 a.m. Please call the roll.
Okay. Silva,
Silva is here.
Williams,
Here.
Epi,
Happy here.
Strathman,
Bethman here.
and Pirog.
We have a quorum. Yes. Okay, great. Thank you. And we do have a remote request for Bill Tarver. Are there any objections to Bill being online? I see no objections. So good morning, Bill.
Thank you, Madam Chair.
So yes, I forgot to say my name. This is Cheryl Strathman. So thank you, everybody, for being here. This is going to be a quick meeting so that we can get these resolutions that we didn't have quorum for last week, so we can not waste any time for all these great programs that we're doing. So I'm going to turn it over to Mr. Isaacson right now. You can, first I'll ask for a motion and a second for resolution for authorization to enter annual King County Health Department grant agreements.
Williams moves.
Williams
Silva
moves.
seconds.
Silva second, thank you. Michael.
Great. So thank you. And thank you everyone for making the special effort for this meeting. That we really appreciate it. This first resolution is something that we do every year, and this is giving us permission to accept funding from different organizations that give us funding on a regular basis. As was pointed out in committee the other day, the writing is quite small because we get funding from a lot of different places for a lot of different programs. So many of these are programs that we've had some for 10 or 20 years, but rather than just doing them one by one every year, we've affectionately called this kind of our umbrella agreement. And again, it's just for you to give us permission to accept these funds. And if we get increases in funding, you're also giving us permission to accept extra money as it comes in too, which we like. So pretty
And
straightforward.
so do we.
Yes.
Any questions or comments? Yes, Dr. Silva?
Good morning, Madam Chair. This isn't particularly linked to staff or a position. This is funding for programs
This is to accept the funding.
to accept
correct.
the funding for
Yep.
these.
So some of these do pay for staff, but this particular resolution is for us to accept the funding. And then these are reflected in our budget that will go for approval for 25.
So I completely understand the need. But one of the criticisms I'm hearing right now amongst the constituency that it's important to address is that we may have too much staff. What happens to these grants if we don't take them? Where do they go?
It depends on the funding source. You mean where would the funding go?
Yes.
Some of these are competitive, so they would go to other parts of the state, most likely, where somebody else would apply for them. Many of these are specific for health departments. So these services would most likely, in most cases, not be available then in Kane County. Yeah, many of these are the tobacco program, the emergency planning, the opioid. These are health department specific grants.
These are grants that were specifically created at the state or federal level to go to health departments. So it's not like we can just say, okay, this then has to go to roads or something else. This is something that has to go to health departments. And if we don't take advantage of it, then we lose out on the
Then we lose the
programs.
services, correct?
Thank you.
Okay, any other questions or comments? Okay, please call the roll.
Silva,
Silva, yes.
Tarver,
Carver, yes.
Williams,
Yes.
Tepe,
Tempe, yes.
Pirog,
Yes.
Strathman.
Yes. Okay, thank you. Motion passes. Now, the second one is a resolution authorizing an agreement between King County Health Department and Association for Individual Development, AID, for naloxone vending machines. Michael,
Carver moves.
I've removed and a second? Seconds, thank you.
So thank you. This is a resolution that's similar to a couple that you've passed previously that allows us the opportunity to put naloxone vending machines into other organizations. We started, one of the first ones you did was for one of our hospitals for Rush Copley. Because it's a medication going into a hospital, there was a little more nuance in terms of getting the permission to make sure everything that all the attorneys on all sides were satisfied. This, I think now we have to the point where we can have a standard boilerplate where we're not even going to have to come to you every time for these, where we can just have the agreement. But this particular one is for our partnership with the Association for Individual Development as part of our overdose reduction programs. Getting naloxone out to people is one of our critical strategies. So this is something that would allow us to put machines at their locations so that their clients and people who are coming into their locations can take advantage of it. And then also I'd like to add, we've had conversations here and Chairman Pirog quite a while ago, I think, suggested that we put machines in our county buildings. So we will be reaching out to the different county departments and different offices to make this available for them as well through our program. So.
Thank you. Any questions? Yes, Madam Chair.
Thank you. And thank you, Michael, for bringing this up. I think it's important that we have access to this free access to our entire population of users who come here to Kane County to do business. As we know, during tax season, there's quite a few people who come oftentimes to our board meetings. We have a large turnout of the public who attends, and being able to provide this at totally discreet, punch a number in, the vending machine gives you your product at no cost. Everyone knows perhaps a relative or a teenager or whomever that may need this. I'm not saying that they all need it. Gosh, I hope no one needs it, but just in case. And you can have it in your car, you can have it at your office, your workplace, throughout Kane County, not just here.
Right.
So it's an accessible opportunity to save lives.
Dr. Silva, did you have a comment?
I was just going to say that for me, it's coming full circle. I remember working with your predecessor, Barb Jeffers, Director Jeffers, and I was chairing the Public Health Committee, and we fought so hard for naloxone to come to King County. She did a wonderful job spearheading this, and you've done a wonderful job just running with it and putting the vending machines in different areas. So this is a wonderful work of great individuals who have worked hard in public health for many, many years. So thank you.
Great. And we have a great team at the health department who's out and partnering with other organizations. So it's really a community effort. So.
And it's such an exciting thing when you think it wasn't that long ago that even first responders could not carry
Right.
this. And now we are making it free to the public. It's just amazing to me. So thank you. Please call the roll.
Silva,
Silva, yes.
Carver,
Carver, yes.
Williams,
Yes.
Tepe,
Tempe, yes.
Pirog,
Yes.
Strathman.
Yes. It passes. Okay, moving right along this morning, we have a resolution authorizing the creation of a position of Fatality Review Manager for the King County Health Department. Moved by,
Silva,
second.
Carver seconds.
Thank you, Mr. Sharper. Okay,
Excellent. Thank you. So Fatality Review is an initiative that goes on around the state and around the country where people come together, professionals, medical professionals, social service professionals, law enforcement, first responders, and we look at information specifically about what's happening when people pass here in our community. We're proposing to start with this Fatality Review with overdoses, but the intent is that we will also look at suicide and domestic violence as well. And really, this is going to give us more concrete information about specifically what's happening here. We have general information that we get, but having these conversations where we're really able to dig in is going to be extremely helpful. A couple of points I want to make. Number one, this is a position where we're looking to use ARPA funding for this right now. But then like all of our funding, and you've got the list of the 20 some other grants that we just approved a moment ago for our positions, because we are mostly grant funded. When the grant funding goes away, the position goes away if we have not found other funding for it. So this is not something where we are looking to add to the burden of the general fund or add to anybody else. This is something that we are committed to finding other funding sources to continue after 2026 when the ARPA funding goes away. And we think that the value of this is going to be so self-evident that we feel very comfortable that we're going to be able to maintain this position on an ongoing basis.
Madam Chair,
yes, Mr. Williams.
I have a couple questions.
Sure.
Mr. Isaacson, why can't the coroner's office do this, or shouldn't the coroner's office do this?
The coroner's office has to be an important partner in it, but when it gets into this type of community work, this is kind of bread and butter for what the health department does. So we have a opioid task force, we have a behavioral health council, we have an early childhood network, we have a home visiting collaborative. This is what many of our team is trained to do, is to bring people together and to facilitate these types of discussions. So the coroner's office has to be a critical part of it. But this is a case where we've actually been trying to do this for a couple of years. So I'm really excited that we finally got everybody on board to be able to say yes. So it takes multiple organizations, but I think we're a logical lead for it.
The other question I have is, what exactly is the salary? Is this one position or more than one position?
Great
And what are the
question.
salaries?
Yeah, thank you. And I actually meant to mention that. So we followed the new position process where I worked with the Human Resources Department. We shared the job description with them. I offered what I thought the grade should be. They reviewed it. We went back and forth a little bit and landed on what the grade for this position should be. Again, based on our internal equity. So comparing this job description to other county positions, I was hoping it would be a higher grade, but that's natural. So where we landed, the salary is between 48 and 70,000 is the range. So we had a question about that at Human Services. So when we put this together, it was a few months ago, and we're hoping to be able to, if the board does approve this position, we're hoping to post it and fill it as quickly as possible, so that it'll be a little more than 2 years that we would fund this position. And then that would include not only the salary, but also all of the benefits as well. I like to point out, and it's something that we try to use as a recruiting tool, even if our salaries aren't necessarily as high as what somebody can make in the private sector, we do offer competitive benefits, but there's a cost to that, and that's why the cost is in there.
So for the sake of clarity, the $210,000 is not for 1 year, it's for multiple years.
Correct, about 2.5 years, correct. Well, not quite 2.5, but a little over 2.
Well, it depends
And I
on-
think it's a little higher than what we need. This is just to get permission in the budget. So depending on when it all gets approved.
Yes, Ms. Peterson.
This projected budget also includes travel for the employee. I just want to mention that too.
Oh, yeah, thank you.
Any other questions?
No, thank you.
Okay, yes, Dr. Silva?
Travel for training?
It could be training, or most of my staff is out at community meetings, visiting community partners, doing other types of collaborative work. So we travel all over the county. So it's a portion of local travel in partnership, and then any trainings. We don't go far, so it's not going to be a huge amount, but just to mention that it's in there with that lump sum.
So for me, this is an answer. We know the how and we know the what. Let's figure out the why. And to me, this is figuring out the why. And we've been used to compartmentalizing our departments, and each department does different things. But if we really want to make a difference, this is where we kind of bridge and look at the aggregate data and find out the why. And so I think this is really important. As you and I spoke when we met last week, I think the important thing is also the personality of the individuals that will take on these roles. They need, obviously we do what we do because we love it and we want to save lives. The other thing is that it's also important to somewhere come up with some data to show the money that we're actually saving by investing in these programs. I was at a disaster preparedness policy institute a few days ago in Houston, and we spoke about the importance of foretelling and forewarning some of these occurrences that will be happening. Whether you believe in global warming or you don't, the weather is changing. So they're predicting that in 5 years, we could see an event in less than every 2 weeks. So disaster preparedness is extremely important, and putting money, as you said one day, and it personally hurt, you didn't do anything wrong. But if we're not investing as much money into mental health, then how do we expect things to change? And I would love for King County to be known as one of the counties in Illinois who can invest and does invest, especially when it's grant money. Thank you.
Thank you. Thank you for those comments. Okay, are we ready to take a vote? Okay, please call the roll.
Silva,
Silva is a yes.
Carver,
Carver say yes.
Williams,
Williams, yes.
Tepe,
Duffy, yes.
Pirag,
Yes, with one comment. Once this position is hired, if you could bring that individual to this meeting. And then after they get their foot, they understand what their responsibilities are. And then follow up on Dr. Silva's comments about what they're seeing as trends.
Yeah.
So we know as a board how to address those if needed.
Excellent. Thank you. Will do.
and Strathman.
Yes. Passes. Okay, moving right along, resolution authorizing the acceptance of the Medical Reserve Corps State, Territory, and Tribal Nations Representative Organization for Next Generation Grant. Do I have a motion and a second?
Silva moves.
Carver seconds.
Thank you.
So thank you. This is a $5,000 grant to allow us to provide some additional amenities to our Medical Reserve Corps volunteers. It's only $5,000, so it's not something that we typically would bring, but we just wanted to highlight. Our staff did a great job going out and finding the funding. This will buy shirts and some things like that that are nice thank yous for volunteers that many of our funding sources won't allow us to purchase, which is reasonable. So this is something that I think is going to allow us to enhance our work and really acknowledge all of the fantastic work that our Medical Reserve Corps volunteers do across the community.
Okay, any comments or questions? Okay. I would just like to say at this point that with this list that we got this time about the grants, it's amazing. And I want to commend you again on all the work that your staff does on getting all those grants. Good job.
We look high and low for money, certainly.
Yeah. Thank you. Okay,
And
please
is
call
now
the
a
roll.
good time to pass the basket around? We can,
Pardon me?
should I pass the hat? This is-
How grateful are we, right? Okay, please call the roll.
Silva,
Silva's a yes.
Carver,
Carver say yes.
Williams,
Williams, yes.
Tepe,
Duffy, yes.
Pirag,
Yes.
Strathman.
Yes. Okay, that motion passes as well. Okay, I'd like a motion to replace the reports on file.
Williams would
Carver,
ask.
so
for
moves.
unanimous consent.
Was that unanimous request? Thank
Yes.
you, Thank you. Okay, thank you, Mr. Williams. Any objections? No, okay. Okay, and I'd like a motion to adjourn.
Wait a minute. We're leaving that quickly?
No, we're.
Williams
you,
moves to
everybody.
adjourn.
Appreciate everybody.
Part
making-
two of a meeting, right? This is not a whole meeting. Part two.
This morning. Hopefully this becomes a pattern.
They came here this morning so we can get this
Hopefully this becomes a pattern in the future.
adjourn.
Motion.
Mr. Williams making a motion and a second.
Silva seconds.